11 deaths due to swine flu is in itself an alert, and it has sent alarm bells already. More than 120 positive cases, and I do not know how many unreported deaths, because many deaths due to H1N1 are not tested and they're not reported, and it's attributed to other diseases in hospitals. Swine flu is a flu virus, also known as H1N1. The first time it emerged was in 2009. The peculiarity about these flu viruses is they keep on changing. They're unpredictable, and when there is a major change, and because of swapping of animal viruses, avian viruses, and the human flu viruses, you have emergence of a new, absolutely novel virus which humans have not seen so far. And when it gets adapted in humans and human to human transmission is with ease, you have an emergence of a pandemic. That's what happened in 2009 when first time this swine flu emerged. And the first lab tested case was a Californian in United States. It was believed that it has the origin from pigs, that's why the name, but the origin is still an enigma. In 2017, because of the change in the virus, the mutation in the virus, we saw deaths in scorching heat in summer also. That's why I then issued a statement that flu is a year-round malady now. It's not confined to winter. But what we commonly see is that once the winter comes, and that too the prolonged winter of Kashmir, we have more cases because these flu viruses thrive in winter, they activate in winter. The scenario which we see this year also is there is some change in the virus, because what we saw in 2009, this was transmissibility was very much human to human transmission was more, but the virulence was less. So less people died in 2009, for example, in Kashmir. So what I'm seeing now also, for example, this is the peak flu activity month, that's in January, we have already seen 11 deaths. The symptoms of swine flu as similar to what we see for common cold. For example, you have runny nose, you have high-grade fever, you can have cough, you can have sore throat, you can have body aches, and there are unusual symptoms like you can have vomiting, you can have diarrhea, you can have bleeding also. The doctors have to think once a patient comes with fatal meningitis, flu has to be thought in the differential diagnosis. Patients coming with bleeding disorders, the flu has to be thought in the differential diagnosis. But as of now, what I see in fatal meningitis, doctors don't think, they don't test. So most of the deaths which happen in the wards, in hospitals because of these fatal meningitis are not attributed to the flu. I would advise my doctors, flu could be a possibility. So whenever you have patients with the, please think of this and treat them. We can prevent people from dying by simple precautions, but vaccine is the single best defense. This year, WHO gave a clear guidelines that you should have quadrivalent vaccine. That means you should have 4 strains. That means H1N1, H3N2, and 2 B virus, Victoria and Yamada, Victoria and the other B viruses. So you should have 4 viral strains in the strain. But I'm seeing in the hospitals people going for the trivalent vaccine, which does not have 100% protection. I don't know. That is not recommended. Recommendations are that every vaccine this year should have quadrivalent protection, 4 viral strains which are circulating in the community. And the predominant strain what we have seen across the globe, including this place, is H1N1. Simple hand washing with soap and water can keep the virus at bay. You get this virus from an infected patient by way of droplet infection. That means if somebody coughs, somebody sneezes, and you're within that reach of 1 feet, you'll get the disease from that infected person. So if you use cough etiquettes, that means cover your mouth, cover your nose once you're coughing or sneezing, will protect other people from getting the virus. And if you are down with flu, stay home, don't go out, so that you prevent this from spreading in the community if somebody gets a flu now. So in that situation, what I have seen, most of the times doctors prescribe antibiotics. Antibiotics are not the treatment against flu, because it does not work. Flu is a viral thing. So what works is an antiviral. These antivirals, if given early, that means within 24 hours, will prevent most of the deaths. So what I would advise, that even if people, those who have not got vaccinated till now, I would advise them to get vaccinated, especially high-risk groups prone for complications and death. For example, elderly, greater than 65 years of age, children younger than 5 years of age, pregnant women are prone to develop complications, and those with underlying medical conditions. For example, those who are asthmatic, chronic obstructive lung disease, those who have heart diseases, who have lung diseases, those who have kidney diseases, liver disease, and those who have underlying cancer. And they are the highest priority group for vaccination, and it's never too late, because ideally you should get it before flu season, but it's never too late. You can get it now also, because the peak flu activity is now. So these high-risk groups should be the priority group, and they should get vaccinated if they have not received the vaccine.